Hello guys, welcome to my YouTube channel. I'm Sarah. I'm a dentistry student. I'm here to explain you some subjects that are related to dentistry like anatomy, topoanatomy, physiology, biochemistry, and also other dental subjects. Uh, for the first time, I'm going to explain you about the anatomy. As you know, for being a dentist, you just need to know about the anatomy of the head and neck, not other parts. Okay, but it's necessary to know these parts by details. I mean, you need to know about the bones, the muscle, the artery, vein, and nerves in these areas. For the beginning, I'm going to tell you about the skull. Um, I can divide the skull into two parts, the neuronal part and the visceral part. What is neuronal part? Um, Neuron is a part of nervous system. Okay, we can say a part of central nervous system. That central nervous system has two parts, the brain and the spinal cord. That's why we call it neuronal part, because this part of the skull will cover the brain. It's like a hat. If I want to show you, it's here. This is the neuronal part. And the visceral part, it's the bone that can make the face. That I'm going to explain to a bit later. Let's first talk about the different bones that can make the neuronal part. In anatomy, we will not say the bone in frontal part or the bone in behind or in back. You need to know some words like anteriorly, posteriorly. Anterior means in frontal part and posterior means behind. Okay, so the bone that can cover the skull anteriorly is this blue one, which we call it frontal bone. Okay, the name is frontal bone, but you need to know that anteriorly we have frontal bone, this blue one, that it starts from the superior part of the orbit. Superior is another Latin name which means in the top. Okay, so the frontal bone will start from the, we can say, supraorbital margin. Supraorbital margin is the margin that is in top of the orbit, the blue one. So the, we can say, this part. Okay, so this part is supraorbital margin, that the frontal bone starts from this part. And it's the first bone that can make the neuronal part of the skull. Another bone which is not clear from the anterior view, or just a small part of these bones are visible, but let me show you another picture. Here is better. You can see the frontal bone, the blue one, and the next bone that is behind the frontal bone, the green one, is parietal bone. The parietal bone is paired. We have two parietal bone in each side. And then after parietal bone, in the posterior part of the skull, we have this purple one, the occipital bone. Okay, and in topoanatomy, you will learn that we call these parts, I mean frontal bone, parietal bone, and the occipital, we call it scalp. okay, in these parts. That the layers in this part are very important, and you will learn it later. It's about these three bone, and again in lateral part we have a bone, the temporal bone, the pink one, that it's again paired like parietal bone. Okay, so this is another view. The blue one is frontal bone, it's not paired. Then in the posterior part we have parietal bone, which is paired. Then we have occipital bone, which again is not paired. And in lateral part we have these pink one, which is temporal bone. The temporal bone is very thin, that's why in most surgery this part is very useful, because they can remove the bone easily from this part. They can make a hole easily in this part. That's why it's better to do the cranial surgery to temporal region, because it's very thin. Okay, it's about the bones which can make the neuronal part of the skull.